Ladies and gentlemen, WSA9's Darren Haynes.
Hello, everybody. I'd like to welcome everyone to our virtual town hall on mental health. I am Darren Haynes, WSA9 sports director and anchor. And what an amazing day to have this type of discussion to try to create change, especially when it comes down to mental health. Closed captioning is being provided today, so please click on the symbol if you need that. There's also a Q&A button if you have any questions throughout this panel discussion. Also, I'd like to welcome in our moderators, because I'm not going to waste my time. I want to get straight to our moderators. And ladies first in this one. And this lady is a big sister to me, or should I say younger sister, but treats me like a little brother. Lesli Foster. Lesli Foster is an award-winning journalist and a mainstay of Washington's news as a weeknight anchor for WSA 9. I mean, she's won numerous awards, Edward R. Murrow Awards, Emmy Awards, AP Awards, but knowing Lesli Foster, she doesn't do any of these things for the accolades. She's just truly passionate about telling stories that make an impact in our community. So that is Lesli Foster. Our second moderator of the day is Harold T. Fisher, and Harold is a broadcast journalist and an author. He's currently the host of the news talk program, The Daily Drama, on WHUR-FM and HUR Voices on Sirius XM channel 141. Harold is a product of an HBCU, just like Lesli Foster, who went to Howard University. Harold went to Morgan State University and is a native Washingtonian. And you saw the slate before this discussion started. Nobody has more swag in their bio picture than Harold T. Fisher. Without further ado, I'd like to welcome in our moderators of this evening or this afternoon, Harold T. Fisher and Lesli Foster.
Thank you so much.
What a fun introduction. And Darren, thank you so much. We love you like a little brother and really happy to have you join us as part of this important discussion. I should say, I have known Harold Fisher for decades. He was a legend in Baltimore. He is a legend here in DC, both committed to community and to making a huge difference. And so I'm really delighted and honored, I must say, to be partnered with a dear friend to talk about something that has been really difficult for our community, both the pandemic and the pandemic of mental health crisis that we want to help our community navigate, because we know we are all in this together, Harold, and we have to move our entire community forward. And it starts by having important, courageous conversations. So I'm really delighted to be here with you this afternoon.
Thank you so much, Lesli. It's good to be here with you also and the WUSA 9 family. This is just really an honor for me as well to participate in this really important discussion with you. There is no time like the present to talk about mental health. Even pre-pandemic, this was a critical issue, but now even more so. So this is a wonderful opportunity to have WUSA 9 join with us in this wonderful discussion. And we really should talk about and introduce our panelists, some great people on this panel today. I'm going to start with Marcie Fairbanks. Marcie is a licensed clinical social worker, and she serves as the Director of Family Services for Capital Caring Health. Now, in her role, she supports the counseling staff in meeting the needs of patients and their families at a really difficult time, the end of life, as well as the needs of the bereaved. Now, in her 20 plus years of working in the hospice and palliative care field, she has witnessed the benefit that holistic service provision affords patients and their family and friends. So we want to thank you, Marcie, for being part of this really important discussion.
We also want to introduce Laura Branker, who is the Vice President of Philanthropy at Capital Caring Health. She's going to have a special announcement to share with all of us at the end of our virtual mental health town hall. So stay here for that. And we'd like to also take a moment to just thank you, Laura, and to thank Capital Caring Health for being a sponsor this afternoon. It means so very much to us and to our community. So thank you for being here today. And finally, we bring in Dr. Linda Mcgee, who is a clinical psychologist. Perhaps you've heard her on the radio. She is a host of good mental health on Radio 1. She speaks out across the nation. She is a nationally recognized expert on mental health, both in children and in families. She spends a good deal of time talking about racial trauma and disparities. She has also spent a good amount of her time of late really working to advocate for a broader conversation about mental health in communities of color and underserved communities who have long been hesitant in some ways to speak out about mental health and to seek out resources for mental health. So we round out this dynamic panel with three women who are going to join us, and Harold and I have the great opportunity to help usher us through some important and courageous conversation. And let's get right into it, because this afternoon is about you, your questions, your needs, and your answers. Dr. Mcgee and Marcie, where are we a year into this pandemic as we take a broader look at our mental health? And Dr. Mcgee, I'll have you start.
Well, thank you, Leslie, for the wonderful introduction. But I want to say we're in a state where we were in a worsening mental health pandemic before the COVID pandemic came along, and we are continuing along that path. Unfortunately, we have a reported third of the population, highest it's ever been in history, reporting signs and symptoms of anxiety and depression. We have increased eating disorder relapses, drug relapses. There's an increasing number of hospitalizations based on mental health impacts. And so we are where you would expect we would be a year and a half into a pandemic. We are in a worsening mental health crisis that is coming to the forefront and definitely needs to be addressed and prioritized.
Marcie?
Yes, and thank you again for the opportunity to even talk about this, because I think opening the conversation to the importance of mental health is critical. Like Dr. Mcgee shared, even before the pandemic, we knew that mental health issues were not really being recognized or served properly due to a multitude of reasons. And then because of social isolation and distancing and fear that has erupted as a result of the pandemic, I think it's really brought to light that we're in a crisis. And this is a crisis that we cannot ignore because these are our people. These are our people that are suffering. And I think it really speaks to the urgency of our community at large to respond in a significant way. This cannot be in a minimalistic kind of approach because even in my field, even individuals who are at end of life, their mental health issues oftentimes become even more significant when they're confronting a mortality and a terminal diagnosis. And we've seen a significant increase in suicidality, as well as, the fear that is caused by anxiety and depression. And so it's a very significant moment in time that we're at right now.
Dr. Mcgee, how do we prioritize mental health and the social aspects of COVID-19, particularly when addressing the issues of mental health? It's not like a broken arm. This isn't the kind of thing that people are readily willing to talk about. So how do we make it a priority?
Well, I want to start with your premise. It is like a broken arm. So we wouldn't let your bones just stick through the surface and not address them, right? We would address them if it was a broken arm. And mental illness is the exact same thing. So how do we prioritize them on an individual basis? You prioritize it by being intentional. You focus on your mental health. You check in with yourself once a day. You take care of your mind, body, and spirit. If you need help, you don't sit there with a broken arm. So why would you sit there with depression? So you go and you get support and you get help. So you focus on it, you pay attention to it. The government and all the insurance schemes need to follow along and support the system of mental health. Our regulatory schemes are not quite caught up to interstate. For example, we're just now getting the right to talk to a client in another state. even if they go on vacation. So we need, as a nation, not just as an individual, to shore up our infrastructure, make sure that the coverage for insurance and that mental health care is affordable and available. So that's how we focus on it, and that's how we prioritize it.
But I would ask though, as a clinician,
Mm-hmm.
I could argue, yeah, that's easy for you to say.
Yeah.
But as an individual who
Mm-hmm.
may be depressed
Mm-hmm.
and may not know it, how do they get there from here? How do they make those first steps in addressing that mental broken arm, so to speak?
So sometimes people do know, and they are just reticent to get help. And in many communities, there's a stigma attached to getting help, going to a therapist. Some areas, including African American community, we think it's inconsistent with religion. You know, we can't believe in God and have a therapist. And I'm here to say you can believe in God and have a therapist. Some of our families are not motivated and don't believe in mental health. So there are some people who do know that that they're struggling, that they're down, that they're anxious, and they have these stigmas that they're facing. Then there are people that don't know. And so what I'm saying to the audience today is that the signs, you have to look at the signs that your life is changing. You're not sleeping, you're not eating, you can't really function at work. Your relationships are suffering. During this pandemic, we're having people who are isolated for long periods of time. So to just look at the signs and notice changes. Any changes, and a lot of times your spouse or someone might point that out, but a lot of times you yourself know, you just really don't want to face up to it. But depression is treatable. Anxiety is treatable. It's all about taking the steps to go get mental health. And for those of you who have loved ones who you know are suffering, have a talk with them, refer them, help them make appointments, help them, at least urge them to get help.
And if I could add, I was just going to piggyback on what Dr. McGee said and just say that, it really does require honesty, and that's really what this is all about. It's about us each being honest with ourselves and then being honest with one another, because we all feel the same emotions. That's just a universal truth, right? In our lifetimes, we have all had traumas, and we have all had a collective trauma as a result of this pandemic. So the fact that we're experiencing anxiety and feelings of sadness or depression would be normal. It is normal. And so it's about normalizing humanity and normalizing human expression. And I would dare say that the breaking of the stigma and breaking through that stigma is putting mental health on the same playing field as medical health, like Dr. McGee said. It's about recognizing that we don't wait until the point of the broken arm to necessarily ever go to the doctor, right? We have well visits. We have checkups to make sure that we're okay. And as a society, I dare say that we need to move towards this normalization of the fact that we need to also do check-ins and checkups related to our emotional state of mind. And that comes to fruition because we're being intentional about seeking support, looking for connection. And then through that experience, we're really able to prevent the crisis. We don't want to wait until the point of crisis necessarily before we seek support. If we just can embed ourselves in this culture of, okay, we are holistic. We cannot separate out the mind, the body, the spirit. They're all interconnected. And so through that recognition, we can then move towards a society and a culture that normalizes emotion.
It's so important. And then when you think of what's compounding all of this emotion is you have really an uptick of people exhibiting complications because it's not just the grief of the pandemic and what it has created. There's also this exposure to many more deaths, and not just the deaths that we talk about here. Right alongside this pandemic has really been an epidemic of gun violence, particularly as we think about the DC area specifically. Every single night there is something. For the past 3 nights, we've been talking about children who've been shot. So we have people who are grieving the pandemic. We have people who are grieving the losses that are an extension of other things that have come out of this pandemic. And they haven't really been able to grieve with community because of all of the stipulations that require us to be isolated and to titrate differently around each other. How do we navigate this, Dr. Mcgee and Marcie?
Marcie is a grief expert, so I'm going to leave the grief aspect to her, but I want to talk about communities of color and what this last year and a half, 2 years has been like for them. We've had disproportionate impact of COVID. We've had, racial crises in this country with the police killings of citizens. We've had all kinds of pile-ons of trauma and anxiety, even to the point where we have lost some of our leaders like John Lewis. So we are in a perfect storm in terms of community of color. And so I wanted to just say a special word to those communities who, a lot of whom have specialized grief, funeral celebrations, and that we cannot celebrate right now. So the losses are the same for many Americans, but for communities of color, this has hit particularly hard.
Yeah, and Dr. Mcgee is exactly right. It is those tangible losses, the loss of lives, through the pandemic or just because of natural disease process.
Mm-hmm.
It's also the symbolic losses. And you can't ignore those. We've all experienced symbolic loss of, our ability to go to sporting events, our ability to engage in self-care practice that we might have once enjoyed. So there's so many types of compounding grief responses that we've experienced that have really shaped a complicated grief scenario. And when we look at the loss then of closure that comes from funerals, that comes from, memorial services and remembrance ceremonies, and those opportunities to grieve with our families and our friends, it creates this kind of void. We don't know how to respond. I've heard many people say, I don't even know if my loved one really died because I wasn't able to see them before they died, but I've been told that they've died, but I haven't been able to really process it because those rituals haven't been available. And so that's significant. That is really significant. And it requires, now that things are starting to open up, I've suggested to people, you can have a delayed ceremony, right? You don't have to just have it at the time that the death occurs. You could create some ceremony of remembrance, in the months to come, to be able to create that special opportunity for individuals to come together and mourn. And more importantly, it's also the opportunity to really be intentional about linking with professionals, professional grief counselors, individuals who are going to offer you that safe space to be able to process those complicated myriad of emotions that we're all experiencing.
Marcie, I wanted to ask you a little bit more about the grief process, because there has been, over the course of the pandemic, an issue where people don't necessarily lose loved ones in the sense of death, but what they've lost relationships. I can say that the pandemic has been quite revelatory, where people show up or they don't. People who you thought were your, as they say, your ride or die, and now they're no longer there. And I know there's a grief process for the loss of relationships, friendships, marriages have collapsed, even if couples are still within the same household. And so now, as we begin to come out, how would you define the self-care of the grieving of the loss or changing of relationships?
Yeah, and it is that complicated experience, because you're exactly right. A lot of pressure has been put on people with this past year, and it has kind of created clarity. I'll put it that way: clarity about relationships. and it's offered clarity about priorities, you know. And I think that that kind of newness about, you know what, maybe certain relationships weren't what I thought they would be or what they were, that can create a feeling of betrayal, you know, and it can create a lot of increased anxiety and lack of trust, right? So when you look at grief, you really want to look at the combination not only of grief due to death, but also grief due to the loss of different relationships, the loss of different, you know, employment. A lot of individuals lost their jobs. They've lost their livelihood. They might have lost their homes. There's been a collective loss of life, and assumptive world. You know, it's really the loss of our things that we took for granted, that we assumed would never change, and they have on a dime, right? So when we think about that, it's really important for us to recognize that everyone's grief journey is unique. There's no stage that we're going to linearly progress through, and then we're going to ultimately come out on the other end of stage 5, and we're going to be healed, and it's all going to be good, right? When we have this collective sense of loss, it's a process. And it is a process that could take weeks, months, or years to work through. And it goes through different iterations and different evolutions throughout that journey, which is why we never want someone to feel like they're journeying alone. And so connecting with others, which right now, we're all in this collective sense of grief. There's a lot of unanimity with the feelings that we're experiencing. There's a lot of opportunity to connect with others if we're honest about the place that we're at.
And I just
And
wanted
we're
to
willing to
add,
be vulnerable.
yes, and I just wanted to add in, there's so much uncertainty around why people might not have contacted us or may not be linking into the Zoom. We don't know what's happening with them. So it's just around this feeling of uncertainty that encompasses all of the things around COVID that's also present. And to see this as an opportunity, even though it feels uneasy and difficult to realign friends at a certain time in your life, especially now when you really feel like you need them, there are people who have come through for you, who are there. And so maybe think about, as Marcie just said, to prioritize those people who have been around for you and who are supportive of you, and to think of it as an opportunity to build relationships with those people.
You know what, Harold, we actually kind of have a question here that is coming into the chat. So I think it would be great. We can kind of pull some questions in from our participants, and thank you for sharing. This question is, do you believe that yoga and prayer are good methods of self-care for grief and for stress?
Dr. McGee, you mentioned the prayer piece earlier. Your thoughts about that?
I think that when we talk about self-care, when you were asking me earlier, what do you do to take care of your mental health? I think you take care of your mind, meaning that you check in with yourself, you check on your mood, you take care of your body, you eat well, you sleep well, and you exercise, and you take care of your spirit. And however that might form, that might take place of yoga, meditation, prayer, church, whatever feeds your spirit. Right? I am not picky. When people come into my office and they say that they love yoga, I'm like, let's go with it for now. Let's increase your yoga. If you need, like I do, 5 minutes without people talking to me a couple of times a day, then do that for yourself. If it's sitting in the corner and reading scripture or reading whatever or watching Netflix, things that feed your spirit, things that are positive to your spirit. And I want to just make sure that I mention to minimize stressors. So if you're having a hard time watching the murder of George Floyd on television, I'm saying straight out to people, limit your media time, because those are re-traumatizing events, right? And so like right now, there's a lot of people telling me I can't watch Underground Railroad. I can't watch the 13th Amendment. I can't watch those shows because it is re-traumatizing for me. And I'm telling them that it is fine to give yourself a break. So to go back to your question, it is perfectly acceptable to do yoga, meditation, or whatever it is that feeds your spirit.
Yeah, and I think this pandemic, I've heard so many people say that they have tried things that they hadn't tried before. I myself have found myself questioning, all the things that used to work to de-stress me, they don't work anymore. This is a whole new level.
You need a vacation, Marcie.
A long one.
We all do.
Yeah, we all do.
And that's part of what I've even told my staff is put it on the calendar. If you don't have something scheduled, it's not going to happen because there's always going to be things that take priorities. But whether it's being intentional about that or mindfulness, a lot of individuals have said that mindfulness has really helped to create that intentional space that's very brief during their busy lives for them to take care of themselves. So however you define it, I think self-care is very individualized. And if it brings you comfort, then it's good.
And also start small. That's where I tell people, just start with, even if it's just 5 minutes where you're just sitting in a quiet space and you're taking a few deep breaths, or you're taking a 20-minute walk. Start small so it doesn't seem overwhelming. And then as you go along, the months pass, you might make a list and say, I'm going to get all of my health appointments in this month. Just small incursions into taking care of the whole mind and body and spirit without feeling overwhelmed by it.
Now, speaking of being, overwhelmed, we've seen, for example, it on the news. So many people are jumping on planes, and everyone is back to partying and celebrations and the like. But the quiet reality, and we can, start with Dr. Mcgee, is that there are some people who are still very, very afraid of going outside. They're afraid of COVID. They're afraid of who may have it, who may not. And there's all of the confusion surrounding the masking or unmasking and the lifting of restrictions. So how do you get someone to go back out, even if it's, as you say, Dr. Mcgee, small steps? Because eventually we all are going to have to get back to some sense of normalcy. How do you get them out?
Well, I mean, you're talking about two issues, and I'm going to start with the people that don't want to leave their house. So when I'm working with them, a lot of them need support because they've been in the house now, a long time. And so I don't want to minimize this. Some people are not going to be able to get themselves out of the house and are going to be very reluctant to go back into a workplace. And so for those people, they might need some extra support. But one of the things that I do is I start by getting them maybe into their backyard, right? So just go out into your backyard and sit for 20 minutes and then go back in house. Then you might build up to once a week going around your block. So you build up from there. Now, I want to go to the other issue where you might not be clinically unable to leave your house, but you're still nervous. I recently got on a plane and I will admit that it was nerve-wracking. And I had masks, but it was very close quarters. And I think that it's quite normal that people are going to feel anxious about going to the beach. And, so my advice is to give yourself some grace in terms of how you integrate, right? If you not feel comfortable going on a plane, don't get on a plane. You might drive but I am urging people to get out of the house because I do think that we've gotten to the point where we've really been in our houses too long and it's causing, more harm than good. So you can still leave your house and try to do so safely. You can drive to the beach with your kids. You can rent a place. You can still isolate if that's what you feel comfortable with doing. But I think now for adults and for children, it is the time to start peeking out there, making some small steps to get out of the house, get some sun on you, and, really start to make plans for stepping out. And then also you have to start getting your children and yourselves ready to go back to school and work. And that is not done on a dime, because you can see what we're talking about, what Marcie has mentioned, is that we're all going out there and we're looking around and we're anxious. You don't want to wait until September 1st to drive your kid to the school for the first time. You want to start getting them acclimated, maybe driving by the school, maybe driving to the school, talking about the procedures that the school has in place. Maybe vaccinating your 12 to 15-year-olds that are now able to be vaccinated. So you want to start listening to them and their concerns and try to start addressing their concerns over the summer. Likewise with workplace environments, Lesli and I had a conversation about how there's going to be many, many rules governing many, many workplaces. Or is there going to be mandatory vaccination? Is it going to be a free for all? Is it, so how is this going to be done? And so we also have to manage the way that we're dealing with our emotions about going back to work. And is it okay to ask people to still mask and all of these things? So you need to start thinking about your own game plan also in terms of going back to work and acclimating yourself to the work environment.
It's so complex, Lesli. It really is. And if the logistics are complex, the mental gymnastics, Lesli, have to be even more complex.
I have to agree. And I'd love for you to go a little bit further with this conversation, because you have some cases where you have people like me and Harold who have been in workplaces, small numbers of workplaces. And there are people who are getting ready to sort of reintegrate into that space. And all of us, if we're being honest, are going through a process here. Those of us who have been there and those of us who are going to be coming back into the space. And so as we talk about building community and all being in this together, how do we help each other? Both those who have been in the space and people who have some trepidation coming in, because we are not the same people we were 14 months ago when this started. So how do we help each other, however we present in our spectrum, our circumference of this experience of coming back together? I'd love to know what both of you think about that.
Yeah, if you don't mind, I'll start on that one. I think a lot of it is just about open dialogue and communication. As an employer or an employee rather, it's important to really understand the expectations of your employer, right? So that there's no ambiguity about what the transition period is like and what the expectations are. And I would hope that every business would have some sort of transition plan in mind, so that it's not just, oh, Monday, you're back to the office 5 days a week, like this never happened, because that would create a lot of increased anxiety and fear. What we're experiencing now is similar to what we had experienced at the beginning of the pandemic, right? It was this on a dime transition to lockdown and the fear that was ensuing with this unknown. And so now it's a similar response that we're having, but on the flip side, now we're expected to kind of reintegrate ourselves into our former world experience, and we have trepidation, and that's normal. I think there's been a huge increase in social anxiety since we've been in lockdown, and it's not to be taken lightly. That can be a significant detriment to one's ability to really be able to make that transition effectively. So to go back to the starting point, open dialogue with your employer, understand expectations, and then have an open dialogue, because many of us have been very successful working from home. Is your work environment willing to allow you some sort of hybrid approach? It's not always appropriate in every work environment, but I think this pandemic has demonstrated that the work norms don't necessarily have to remain that way. If anything, I know I've been a lot more productive. The work-life balance is totally different when you're working from home versus going into work. But it certainly does create a better mental health perspective when you don't have multiple hours of commuting and dealing with traffic and all those other compounding factors. So I would just encourage open dialogue.
And I would say, with regard to our coworkers, is that we really have to have consideration for other people, and we have to understand that we are all in this together. And it is not a factor of you get your way, I get my way. It's a factor of having consideration for the person who might not have been vaccinated, having consideration for the person who might be anxious, and to know that that could happen to any of us. I went into a farmer's market the other day and I was very anxious because there was a lot of people there, and there were some of them were masked and some of them weren't. So just to take it back to humanity a little bit, you might have people who are in varying states of physical and mental health, and to have consideration for those people. And as Marcie said, keep the dialogue open. I'm concerned a lot because I'm wondering if people are going to return, even if they're asked to return to the workplace. I'm having inquiries from people who do not ever want to return to the workplace. And so we haven't touched upon that, but I'm concerned that people are not going to want to go back to the workplace in the absence of really clear rules and boundaries.
Well, can we talk about that for a bit? Because when you talk about the work-life balance, and I know even for, myself, initially working from home, there were the physical manifestations. There's a whole lot more of me now than there was 15 years ago. And I'm working on that. But when I would wake up in the morning, there was no breakdown because I was working from home. So as soon as I opened my eyes, I was working. And that was the case for a lot of people. And so whether they are returning or want to return, their work-life balance has changed from work-life to work. Mm-hmm. How do they process that from a mental health perspective, Dr. McGee and Marcie, because life has changed?
I mean, I think this is individualistic. I'm personally, and I know a lot of people who are happy working from home. I have a niece who works for Google, and they've gone to permanent, only 2 days a week in the office. And that seems to be a good consensus. And as Marcie said, we're just living, we got to adjust to the world as it is. And sometimes it might make sense to not go back to expensive office spaces and places where people have to come into physical contact. I think the work world is going to be changed forever. But what I was really pointing to is people who've made the decision based on health, based on, in fact, on finances, that this industry that they're in, like I've talked to many teachers who, in the absence of really clear guidance for the fall, are taking retirement. Physicians and nurses, the same thing. So, and for reasons of mental health, anxiety, or what have you, have made the decision that they're never going back to the workplace. But in terms of the individual who's at home, there are some people who feel like going to the office is a vacation, right? And it's better. And also, we're dealing from this. Or at least I am dealing from it from a position of privilege because I have a home office that I'm sitting in. There are people who don't have physical space that they can separate. There's no kid area. There's no ability to separate. So those conditions are very different from someone who has plenty of space and plenty of opportunity to spread out. But I think it depends on whether home is the place you want to be in 6 months or whether it isn't.
And I would add that I think this pandemic and being at home has offered us the opportunity to be introspective about our priorities. You know, those things that we might have prioritized 15 months ago may seem insignificant right now, right? Given everything that we've been through. I think we all recognize a little bit more clearly that life is not infinite, that we are all shaped by our mortality. And even though we think we have control over things, that's really an illusion. And so what we do with this precious time on Earth is up to us to a certain extent. So for those who do have the ability to make choices and say, you know what, I'm not going to do it anymore. I'm going to prioritize my family, right? I know I have 4 children, and being at home, yes, it was crazy, right? Yes, it was hectic, but I realized I really like my kids. I mean, not that I
Did it
didn't
take
know it.
this to show you that, or kind of like them?
No, I knew it before, but it really brought it to
Mhm.
forefront. You know, I have 2 in college and they were at home, and I was like, "Oh, this was a gift, right? It was a gift of time, and time is precious. And so we really get to kind of cultivate the kind of life we want. And maybe before the pandemic, we felt kind of like we were on this treadmill and there was no way getting off. Well, the giant pause that happened helped us realize we don't have to get on the treadmill.
Right.
We can reinvent ourselves and reinvent our lives.
You know, a lot of people out there made the decision that they're not going to, myself included, are not going to commute anymore. You know, just decided that I didn't like getting off at 7 or 8 and then having a 45-minute drive, getting so much more done in that hour and a half or 2-hour commute than I never would have done. So we are all sort of reconfiguring, adapting, figuring out where our kids are going to be in the fall, how our lives will look. And, you know, even for those of us, and I don't know if Marcie, you have 4 kids. I don't know if you have any, but like, you know, where are they going to be in school? I have people that are saying, well, you know, they don't want their kids to be in a big public school. And, you know, so people are trying to reconfigure their own lives, but also looking toward supporting their own kids' mental health and well-being. We haven't talked about kids a lot here, but I've had clients and kids that I know who did not function well in this COVID environment. And we've seen a market increase in depression, anxiety, but also just not being adjusted to being on a Zoom for 6, 7, 8 hours a day. And if you think about it, for those of you who've taken one Zoom class for 1 hour a day, you think about multiplying that times 6 and then putting an 8-year-old in front of a computer all day. It's just, you know, it hasn't really been conducive for production. And so we all need to make decisions about what do we do now that the child might have been shut down for a year. So those are also considerations that we haven't talked about today that are important.
Can we give a little more attention to that? Because I know a lot of people who may be listening to us have children, have families. I've got a high schooler. You all both have children in different parts of their life experience. So what should parents be doing? What's the most important thing to do this summer with our children to help them through this? I have been just telling people to remember that this whole experience has likely been traumatizing for our kids, and it will show up in different ways, and it may show up differently in certain kids. And also, you know, getting us to accept that, you know, maybe our kids aren't going to get straight A's this time.
Oh, yeah.
Maybe something is just not going to be perfect. And we need to be okay with that. You know, we need to take the pressure off them a little bit too. So how do we create an action plan for mental health for our children and by extension for our families?
I think that prioritizing mental health, number one. This is not the year to try to make huge academic, any kind of gains other than keeping yourself and your children sane. And this summer, maybe getting them out and getting some sun and having some fun, because this has not exactly been a fun experience this last year and a half. They haven't been able to socialize with their kids. That they worry. Like I had someone the other day tell me that he's pretty sure he gave his grandmother COVID and his mother died. His grandmother died. So, you know, Lesli and Marcie have emphasized that this is a traumatic experience. So to center the response around the COVID, that the calculus grade can wait. The academics can wait. Now, I know that there are people out there that are going to have to make some academic decisions also, but I really wanted to emphasize and repeat my emphasis on mental health emphasis, because then we can then talk about what happened this year. Did your child metabolize anything of the 10th grade? And make some decisions based on that. And I've had people that I've been advising to take a pause and maybe repeat a grade. Of course, the school systems themselves are going to make their own decisions, but as far as I'm concerned, you have to make a decision based on your own child and where they are, the child in front of you, who may not have listened to a thing that was said this year, that may have been traumatized, depressed, or whatever. But to make some individual decisions after about academics and where they are, after you've sort of taken care of the mental health and shoring them up in that regard.
Yeah, and as a parent, I think realistic expectations is critical. I remember my husband and I at the beginning of the pandemic going round and round. What do you mean he's got a D? You know, our gifted child is failing these classes, and it was an evolution in expectations, and a recognition that this is not normal, and we cannot expect normal results, regardless of how much tutoring we throw at our child, which we in turn ended because we recognized that was our thing we were trying to put on him, and it was not helpful, right? So the other thing is being attentive. You know, I know we all have a lot going on, but as a parent, I think right now we need to pay careful, special attention to our children, to observe their sleeping patterns, observe their eating habits, and tune in to their mental health state of mind. And like Dr. McGee said, this summer should be about re-entering the life that we are going to lead moving forward in the fall, right? How do we re-enter this world with fun activities, going to the park, trying to re-engage in life again? And we have a period of transition before us with the summer months leading up to fall. So it's a great opportunity as a family to collectively start to make those baby steps towards normalcy.
That just brought up a really important point, Marcie, because mental health is directly connected to physical health. If you're not feeling good in your head, your body's not going to feel good. And talk to me about how to redirect the old priorities so that we can return to a sense of normalcy.
Mm-hmm. And I think, you know, the key is intentionality. You know, sometimes we have to force ourselves to do something to move onto a better path. And so trying to create those incremental changes that are going to take us in the direction that we know we need to go in is going to be vitally important. And we're not going to be successful unless we kind of map out what our specific strategy is going to be to re-engage ourselves in the world.
And as Marcie and I both touched upon, it's a lot of these issues are related to parents facing their own fears, right? And what it is that we're trying to accomplish here. And are we looking at the kid that's in front of us with all of his interests and how he's gone through this last year? Or are we looking at that child in our dreams that we have, that superstar who's weathered this whole pandemic somehow extraordinarily above everyone else, right? So we have to just really face our own fears. Like I keep telling people, your kid is in the same position as everyone else who's gone through the pandemic, who's gotten a lower grade. So there's not so much loss as in the minds of their parents, because we're fearing that our child's going to be behind. But I just want people to just take a deep breath, focus on the mental health, and then, like I said, methodically deal with the other issues once you've shorn up mental health.
Can I ask a question about the elephant in the room? We know vaccines have been a divisive thing in this country, and vaccines are the way forward, according to what our health experts have been telling us. But there may be some people for whom just the idea of receiving a vaccine can impact their mental health. And there may also be people who maybe have chosen to get the vaccine and are quite anxious about the people who have chosen not to. So how do we not lose our minds about this? Because this is a really big deal at this point. people who are getting vaccines, people who maybe have some vaccine hesitancy, and the people who have resistance, who just say, no, I'm not doing this at all. And this idea that this is the way forward. So how do you help people wherever they are navigate this space going forward?
I did a radio show about this, and I was really interested in the fact that I got callers that I never got that many callers on my radio show, and I got so many callers, and I was so surprised because I don't get callers. And so, but their questions were legitimate. You know, they were asking about how this vaccine came about, and we had experts on the show who talked about how this research had been in place many years before, but the questions were rational. You know, many were, because my radio shows on Radio 1 is listened to by a lot of African Americans. They were like, well, how do we trust the government? And I mean, that is a legitimate question. You know, trust in the vaccine, trust in a system that hasn't always elevated the interests of Black Americans to its highest. Those are legitimate concerns. I'm also getting a lot of inquiries from people who don't want the vaccine, but they're in jobs where it's going to be mandatory for them to get the vaccine. And so just working through that process, because it is a choice to not vaccinate your family, even though that might provoke anxiety in a lot of people who've gotten the vaccine. You know, it's not going to be a mandatory thing for all of the Americans to get the vaccine. I'm pretty sure about that. And so we're going to end up in a situation where there are going to be people who aren't vaccinated, and there are going to be people who are vaccinated. And how we deal with those is going to be really, really important. And to accept the fact that you may not be able to like have a knockdown, drag out fight with your colleague at work because they didn't get the vaccine. Or by the same token, you know, trying to undermine people getting the vaccine. We're going to be in this ambiguous world. And again, we are collectively in this together. And unfortunately, we're in a point in time of American history where there is a lot of divisiveness that and political things that translate over into this vaccine that are complicating the picture.
You know, I could add to that. I've been vaccinated since February 28th, and a lot of friends, family, have come to me asking, well, what happened? What were your side effects? How are you feeling? How are those horns that you've been growing? You know, how is that, you know, working? And the thing that I think has really helped my family and my friends who were skeptical is to talk them through it and to show that I didn't grow an extra pair of legs, or I didn't grow horns, or, you know, I'm not green or something like that. And, you know, and I feel fine. And as Lesli mentioned earlier, I've been out. We've been going back and forth to the radio station, and I've not had any consequences as a result. Yeah, I've been masked up and everything else. And so being in this together and providing information based on your experience, I think really helps.
Absolutely. Yeah, I think people are going to feel more confident once they start to see more individuals survive vaccination, right? And come out feeling more confident. And now with the CDC releasing different, you know, mandates that you can, if you're fully vaccinated, basically live life as if you did pre-pandemic. That's incentivizing for many individuals. And so hopefully that momentum will build. But we're probably never really going to know, right? We just have to be responsible for ourselves.
Well, we want to thank both of you for spending this time with us, for answering these important questions, for helping to create a roadmap of sorts for all of us to kind of govern and comport ourselves going forward. We don't always know what's next, but we do know that what's next depends on what all of us do. So I just want to say thank you. And Harold, I think you've got the first.
Say again, I think you broke up just a bit.
I'm sorry. I think you're up next. I'm teeing it up to you.
Yeah, this is such an important conversation. The mental health piece really needs to be destigmatized, whether it's COVID or anything else. And we need to talk to our friends, we need to talk to our families, we do need to reach out to each other and make sure that everyone is okay. And I say, particularly to the guys, because guys don't always talk about these kinds of things. And so it's important for the guys to kind of, man up and reach out to your buddy and say, how are you doing? Particularly as we move out, what help, do you need? And it's so important, when we have people, like, Marcie Fairbanks, and we want to, thank her for being a part of this great conversation, as well as, Dr. Linda Mcgee. I mean, just wonderful, wonderful people, and the kind of advice and the kind of help that you provided here is invaluable. I want to thank you both for really helping us get through this conversation.
And I want to thank you, Harold, and our radio partner, 96.3 WHUR, for being part of this journey, this very important journey. And we leave, but we don't leave without thanking our sponsor and giving Capital Caring Health, it was a special announcement for us, an opportunity to do that. So please welcome, before we leave, Laura Branker, Vice President of Philanthropy for Capital Caring Health. Laura?
Thank you. Thank you very much. Capital Caring Health is very proud to join forces with you to present this Mental Health Matters Town Hall. I mean, as we've had this discussion, this is clearly a very critical issue for our community. So I want to thank you for that. This town hall was inspiring. It was inspirational, informative. I mean, I just, hope that the viewers are going to take a lot of information away from this. The one key point that I think resonates the most is that no one in this area should go through the grieving process alone. There's so many resources. We've heard from Marcie and from Dr. Mcgee, so many ways that they can check in with themselves, but no one should do this process by themselves. And at Capital Caring Health, we have a large number of professional grief counselors who offer a variety of services that are absolutely free to everyone in this community. I have to repeat that again, absolutely free to this community. They work with anyone who's experiencing loss, and that loss could be of a loved one, a neighbor, a colleague, even sort of their beloved pet. That's a huge point of grief for many people. We offer a number of different support therapy sessions, either as a family or individually. We do this also for children as well as adults. And I'd like to give everyone contact information. There's a dedicated phone number, a toll-free number, 844-4-GRIEVE. And I'll give that again, 844-4-GRIEVE. We also have our website available with a lot of really key information, capitalcaring.org. And then a final ask, if you feel inspired to support this work with a donation, allow us to continue these services, expand these services, we also have an opportunity for you to give as well. And that's at capitalcaring.org/give. But I just want to thank everyone and thank you very much for this opportunity. And really, this is a critical issue in our community. And thank you for joining forces with us to get the messaging out.
Laura, thank you so much again. And that number that you can call if you or a neighbor or a friend or a family member needs a resource is 1-844-4-GRIEVE. That's 1-844-447-4383. From all of us here at WUSA 9, at WHUR, for Dr. Mcgee, for Marcie Fairbanks, for Capital Caring Health, thank you so much for joining us this afternoon. And here is to a more productive way forward. We wish you health and strength. And remember, we are all in this together. So thank you for being here with us together this afternoon.